Yep. Good afternoon, everyone. Welcome to the Endocrine Grand Rounds for today. So we are very happy to have Megan Coriell from Pediatric Endocrinology talk to us today. She is obtained an undergraduate degree from University of Kentucky, but then came to Louisville, did her medical school, did her residency in Augusta, and came back to Louisville to do her fellowship in endocrinology and metabolism, pediatric endocrinology and metabolism, and stayed on faculty. So we were fortunate enough to have her here as an assistant professor. And she's given us a talk previously last year. And she is today going to talk to us about a very interesting and upcoming topic in the field of endocrinology, and in fact, in all of medicine, about artificial intelligence and endocrinology, exploring innovations and impacts. So we're very eager to hear where the future is going to take us. So, Megan.
Thank you. All right. Yes. This is definitely a very hot topic right now. And I have found it very interesting to explore. So I don't have any particular disclosures. This idea kind of came about from discussions I was having with my husband. So he was talking about ways like we got a flyer about an artificial intelligence model we could use in clinic to help us with our note writing, and he said, "I think you should do this because I think you spend way too much time, writing notes, and I want you to have more time to do other things." And so that kind of opened the gates to us talking about artificial intelligence and what is it, and how could it be beneficial. And so that's kind of how I decided to explore this topic more. I have nothing to disclose. So our objectives for today will first understand the basics of artificial intelligence and how it works. Then we'll learn about the current uses of AI in medicine, and then further explore uses of AI in endocrinology specifically. We'll then discuss future applications of AI in medicine, look at barriers to implementation and limitations of AI in healthcare, and then review some ethical considerations when using AI. So first, we'll start with our introduction to artificial intelligence. So the roots of artificial intelligence can be traced back to the 1950s. In 1956, Alan Newell and Herbert Simon made a logic theorist that was the first AI program with the ability to solve math problems and to solve a selection of math theorems. And since then, it has continued to grow. Um, Artificial intelligence, at its basics, refers to the development of computers or machines that can perform tasks and make decisions that typically require human intelligence. So they can take large amounts of data, identify patterns and trends, and then make predictions or recommendations based on their analysis. There are different AI techniques and technologies. The one that we have all been exposed to the most is machine learning. So this involves algorithms that allow computers to learn from data and make predictions or decisions without explicitly programmed for each task. And they can learn from their experience and improve their performance over time. Then there is deep learning, which is a subset of machine learning. It involves artificial neural networks with multiple layers capable of learning very complex patterns and representations from data, similar to how the brain functions. Then we have natural language processing, which refers to AI techniques that allow computers to understand, interpret, and generate human language. There's also computer vision, which is an AI technique that allows for analyzing and interpreting visual information from images and videos. And then we also have robotics, which are AI systems that control robots to perform tasks either by themselves or in collaboration with humans. And this has been proven to be very beneficial in in like the auto industry and things like that. So there are also different levels of complexity in regards to artificial intelligence. So narrow or weak AI is dedicated to help with a specific task. So it focuses on solving a very specific problem and it has a very limited scope. So examples of this would be the algorithm that keeps spam out of our inbox and our email, our smartphone helping us find a nearby restaurant, those types of things. Then there's general AI or strong AI. It's more advanced. It takes knowledge from one domain and transfers it to another domain. And this is considered to be the future of AI. So we're not there yet, but it's where we are going. And then super AI refers to machines that are significantly smarter than humans. And this is just a theory at this point, but perhaps the future, but very much just a theory right now. So, what uses of AI are there just in our day-to-day lives that we've been exposed to? So, I think it's important for us to start here because AI has been a part of our lives for longer than I think we realize, and so it allows us to see when we talk about the healthcare aspects how it could really play a role in healthcare. So, recommendation systems are things like Netflix, Amazon. So they use AI algorithms to provide personalized recommendations based on the user's previous behaviors and choices. We have natural language processing, which are AI techniques that are used in things like text summarization, language translation. So, like Google Translate would be one of those types of systems. Image recognition, so AI algorithms that are used for facial recognition, object detection, medical image analysis. So examples of this would be like security systems, vehicles, like in the cameras that like alert you when you're backing up and something's in the way. That would be an example of that. Speech recognition. So, AI based speech recognition systems allow voice controlled interfaces and virtual assistants. So, you can interact with them just by spoken command. So, Siri, Alexa, those are examples of this. Medical diagnosis, which is something we're going to talk about in great detail. But these AI applications include analyzing images for diagnoses, so analyzing x rays, MRIs, CT scans. Then we have financial fraud detection. So there are AI techniques and algorithms that analyze transaction patterns, user behaviors to identify potential fraudulent behavior and can help prevent fraud. Autonomous vehicles. So vehicles nowadays have a lot of AI algorithms within them. I think my husband jokes that cars sometimes more are electronic than they are, motor vehicles at this point. So there are lots of features like lane keeping assistance, adaptive cruise control, collision avoidance that use AI algorithms. And then, like we mentioned earlier, manufacturing and robotics. So very much used in assembly lines, used for quality control, material handling. So large language models are the newest era in artificial intelligence. So these refer to a type of AI that is trained on vast amounts of text data to understand and generate human-like language. So it's designed to process and generate text, including natural language text, dialogue, and other forms of communication. And at their basic form, these large language models are just using probability to guess the next word in a sentence, essentially. And so these large language models are things like Chat GPT. Bing also has an AI search engine that you can use, and you can ask them questions, and then it essentially searches its database, which is basically the internet. So, like ChatGPT was trained on the internet, everything in the internet up to 2021. And so it will search all that data that it has stored and provide you with a response. And it does it, within 30 seconds. Being that its particular AI algorithm provides you with references as well. So when I went to start this presentation, I asked these chat GPT programs what, I need to make a PowerPoint on artificial intelligence in healthcare. How, what should my topics be? And it like generated a bunch of things for me. And the Bing one provided me with articles like PubMed articles, links to these, tests. So it provides, it's not just using like Wikipedia and things like that. It's trained on a large, vast amount of data and can pull from that. So is very, there's a lot of potential um, in these programs. So, what are the current applications of AI in healthcare? So, the first FDA approved AI based technology for clinical use was granted in 2015, 2016. There are now 692 AI or machine learning based FDA approved medical devices and algorithms. And this is as of October 19th, 2023. 77% of those are in radiology. The primary goal of these related AI applications is to analyze relationships between clinical data and patient outcomes. The big benefit of AI in medicine is that it can sift through large numbers of medical images, large amount of patient data and history, and then present the relevant images to the clinician. So in medicine, there are two main types of AI that we see. There's assistive AI and autonomous AI. So assistive AI involves technology that completes a task and provides the medical professional with additional information that then they can use to make a diagnosis or treatment. Whereas autonomous AI involves the technology to complete the task, but then also provides a medical diagnosis without needing a human to interpret the data. So there are lots of areas where AI programs are being applied currently in medicine. So healthcare analytics is one field that is up and coming. So they use algorithms that are trained on historical data and current data to provide insights, improve decision making, and optimize health outcomes. There is precision medicine, which is essentially, just trying to find ways to make things more personalized for the individual patient. And there's a big push for individualized medicine that we have all been seeing over the last several years. Um, it can also be used to predict diseases and illnesses. So, as you'll see when we go through a lot of these studies, a lot of people are trying to find ways that they can predict someone's like their risk for developing certain diseases, so that we can, preemptively help them not develop that disease. It can also be very useful in drug development and protocol development, and then also in patient monitoring. So now let's get into the specifics for artificial intelligence and endocrinology. I will say I was extremely surprised when I started this, just how many studies have been done looking at and trying to create algorithms specifically for endocrinology, both in adult and in pediatrics. So there is a lot of information out there. I honestly had to cut things out because I kept adding more studies because they are very interesting. So there's a lot out there. And I think we're just going to keep seeing more and more being published on it. So, screening and diagnosis with artificial intelligence. So, this is not necessarily specific to our field, but certainly important in our field. So, it can streamline the diagnostic workflow by analyzing extensive patient data, including medical records, images, lab results. So, it allows for more precise and efficient evaluations. So, sometimes we get those patients that have 100, 100 pages in their past medical history. Um, and we're trying to sift through them. Well, these algorithms can sift through them in 60 seconds instead of 30 minutes that it takes us. So that could potentially be very beneficial. It can allow for earlier disease detection, which would improve prognosis and allow for earlier interventions. It can also help optimize allocation of public resources. So, by identifying those who are more at risk, we can make sure we provide that population with testing and to avoid testing that is not necessary in populations that are low risk. And it also has the potential to expand our understanding of diseases by finding new clusters and associations that we haven't been able to see. So diabetes care is probably the biggest area that AI is already in our world, and I think has a significant potential to be very beneficial to us and to our patients. So, closed loop insulin delivery systems are AI designed algorithms. And then we have AI that's being used to develop an automated insulin delivery system that is supposed to be like an artificial pancreas. I know this is something we have been hearing about for a long time. And, this is something that the AI is playing a huge part in. So, this system observes and obtains information from the user's response to exercise, food, and other factors, and then adjusts their insulin. So, is essentially supposed to be a more advanced form of the closed loop insulin delivery system. So DreamMed Diabetes is an AI algorithm that is made to provide personalized optimization for insulin therapy management, and it uses adaptive learning algorithms to emulate the way expert endocrinologists evaluate their patients. So you upload your data from your CGM, your pump, your glucometer. Then the advisor, which is like the cloud, pulls the data, analyzes it using the MD logic algorithm. It looks for patterns, highs, lows, other types of patterns, and then the advisor makes a full titration recommendation, including optimization of basal rates, carb ratios, correction factors. And then it provides the healthcare provider with this recommendation. And then the healthcare provider then edits it and then provides it to the patient. So it is something for the healthcare provider to use to help them make these adjustments. So this particular study, this group developed a reinforcement learning algorithm to aid in determining the optimal dosage of long-acting insulin for individuals with type 1 diabetes. So they took into account a lot of different factors. And what they ended up finding was that a patient's A1C, BMI, activity level, and alcohol use were the best factors to use when determining the best Lantus dose or long-acting insulin dose for these patients. Of the 60 test patients, 53 out of the 60 cases, the physician prescribed Lantus dose was within the dose interval recommended by this algorithm. So it was 88% of the time it agreed with the physician's plan. Diabetic retinopathy is something that I came across as an area that has been very much booming thanks, with AI. So there are lots of studies, and there are actually lots of different FDA approved um, products already out there for adults to help with the diagnosis of diabetic retinopathy. So as we know, the ADA recommends screening for a diabetic retinopathy in patients with type 1 diabetes within 3 to 5 years of diagnosis, and then at the time of diagnosis for patients with type 2 diabetes, and then yearly follow up exams thereafter. Um, there have been studies that have shown that only 35 to 72% of youth with diabetes actually undergo eye exams in regards that follow the clinical guidelines. And so this is definitely an area of concern. Are we missing patients with diabetic retinopathy? And so the C study used a non-mydriatic fundus camera with autonomous AI system for detection of diabetic retinopathy in a pediatric center. So the diagnostic ability of the AI was 97.5%, and it was found to be um, quite sensitive and specific when compared to reference standard as defined by retina specialists. And then I think the biggest thing this study showed, though, was that adherence improved from 49 to 95%, which is huge. It was way easier for families and patients to undergo this this particular you know, imaging analysis than going to an eye doctor and things like that. So there are iArt and IDX-DR 2.0 are both FDA approved and widely used screening for adult patients. The IDX-DR 2.0, the trials showed that this technology was actually used in the adult primary care setting, and it demonstrated a sensitivity of 87% and a specificity of 90%. So they found it to be pretty useful in that area. iArt is another FDA approved technology, and it is something that any physician can use to quickly diagnose patients with, to see if they need to be referred for further exam. So you take a picture, you upload it to the cloud, and then 60 seconds later, the cloud provides you with an analysis. They found that it was highly sensitive and highly specific. And it is great because it is something that could be done in in the endocrine office during their visit. I mean, we wait, 5 to 10 minutes for our A1C to come back. So waiting 60 seconds to see if we need to refer someone for their eye exam would certainly, hopefully, be something we could easily add in the future. I should also say I could not find anything on like how much any of this technology costs. So, so I do not know, and I could not. These websites. It was always like submit if you're more interested, and but nothing specific about how much it costs. Um, this particular study tried to create a machine learning approach to help determine the risk of developing complications from diabetes in patients with type 2 diabetes. So they focused on 6 particular categories, looking at eye complications, cardiovascular disease, cerebrovascular diseases, peripheral vascular diseases, nephropathy, and diabetic neuropathy. They developed a supervised learning model that used a tree-based algorithm to predict the occurrence of each complication within a span of 5 years. So they predicted the onset of complications of patients that didn't have any complications at baseline. So what was their likelihood of developing these complications in 5 years? And then they also looked at separated it between what's their risk within 2 years and then later within 3 to 5 years. And what they found was that their model was relatively accurate. So it was most accurate for the cardiovascular disease and the nephropathy. Um, but everything exceeded 70%. And they felt that that was pretty significant. It was most sensitive in predicting the occurrence of the complication in the 3 to 5 year range between cardiovascular disease and nephropathy as well. So there's a lot of studies trying to predict not only the risk of developing complications, but also the risk of developing type 2 diabetes specifically. So they're trying to use AI for those types of things. So moving on from diabetes to other areas of endocrinology, this group used CT-based machine learning models to differentiate subclinical PHOs from lipid-poor adenomas in patients with adrenal incidentalomas. So the machine learning prediction models and scoring systems for differentiating these types of tumors was built using three different approaches: logistic regression, support vector machine, and then random forest approaches. So basically, they started with three different models and then determined that the logistic regression model was the best. And so most of their study was done with that particular model. The results suggested that a non invasive imaging method, such as a pre-enhanced CT, could be used to predict the histology of adrenal tumors. So potentially eliminating the need for, you know, for biopsy in some patients. In bone disorders, there is also some movement to add AI to this field. So, one group developed and trained a supervised machine learning model to detect prevalent vertebral fractures using non-fractured vertebral regions from CT scans performed for various reasons. And what they found was that by combining the 3D texture features and the regional VBMD, that they were able to be more accurate and identify patients with vertebral fractures or people at higher risk for these fractures better than just by using bone mineral density. It has also been used in diagnosing primary hyperparathyroidism. So, particularly in patients after neck surgery. So, this particular study, they looked at patients that underwent neck surgery for various reasons, and they trained their model to distinguish between primary hyperparathyroidism from normal physiology, and they used a combination of lab and clinical data. So what they end up doing is creating a algorithm that used various different aspects of pre surgery indicators. So age, gender, calcium, phosphate, PTH, vitamin D, all the things that we use when we are also determining this risk. And they were able to show that this model was 95.2% accurate and diagnosed 95.2% of all primary hypoparathyroidism patients. It was not as accurate with patients that had mild disease, which is not surprising. That some of the nuances that humans can pick up on, the machines cannot necessarily pick up on unless they are trained on large amounts of data. And this particular study, I didn't write down how many patients they used. It was 1,700 patients. So a pretty big N, but still, there's still some limitations. So one study that I thought was very interesting was this group that made a machine learning algorithm to help predict adult height in pediatric patients. So they used a machine learning model to predict adult height from growth measurements of children before and at the age of 6 years old. And they used an algorithm called a random forest and compared three common expert derived metrics. So they compared target height, conditional target height, and the grandma method. So the target height refers to the mid-parental height that we calculate for our patients. The grandma method refers to doubling of the kid's age at 18 months for girls and 24 months for boys. And what they found was that their AI model was dramatically more accurate than any of the other prediction methods that we used. The best predicting features were sex and height at age 3.4 to 6.0 years. It was found to be more accurate in females, and they think this is because females reach adult height earlier, and so less chance for variability there. And it's not very accurate in very tall or very short people. So again, at the extremes, it's not as accurate. And they also were very keen to mention that individual variation in pubertal height gain cannot be predicted still in childhood. And I know that is something that our families desperately want us to be able to do, but not sure that we are there yet. Thyroid nodules is another field that AI has become very useful in. So there are a couple different FDA approved, um, algorithms that can analyze the thyroid and detect nodules and help distinguish between benign and potentially malignant nodules. So this MCAD-UT is one in particular. That uses different it looks at very different characteristics by using an ultrasound and combines all the different features to determine is this what is the potential for this to be malignant. ThyNet is another, another algorithm that is being used, and the studies have shown that both of these have the potential to improve diagnostic accuracy and to help reduce the number of unnecessary FNAs, which is certainly beneficial. So, people have also worked on creating AI algorithms to help with optimal doses for levothyroxine after thyroidectomy. So, this study constructed a supervised machine learning model to facilitate levothyroxine dosing. They used a Poisson regression levothyroxine dosing, and it correctly dosed 64.8% of patients. Um, Compared to the standard weight-based dosing, correctly dosing 51% of patients. So they also looked at the literature and found that there was one particular method that was not very effective. And essentially, their dosing model outperformed all the current existing models and methods in each BMI group, which I thought was interesting that they looked at different BMI groups in particular. This picture, it shows the different parts of the algorithm. So what it takes into account. So weight, BMI, age, the pre-op TSH, of course, male, female, and then iron supplementation and multivitamin mineral use. And then it provides you with a dose estimate. Um, so their findings revealed a notable enhancement in predictive accuracy compared to our current weight-based dosing approach. So could help, us get the patients on a more accurate dose more quickly, reducing, the need for follow-up labs that most patients often don't do, and could just help all of us in the end. So puberty is an area that there's not quite as much um, going on in regards to AI research, but there have been a couple studies looking at central precocious puberty. So this first study looked at using a diagnostic model based on clinical features and then a single sample 30-minute post-stimulation lab results. Um, I honestly, it was very accurate. And their goal was to reduce distress for children caused by multiple blood samples, but honestly, it doesn't really, narrow down because our Lupron stem test is about 60 minutes. So, I mean, 60 to 90 minutes. So it doesn't really cut down that much on what we have to do. But then we have this other model that used uh, was used to determine if exposure to certain, endocrine disrupting chemicals had an impact on when menarche began. And they looked at lots of different combinations of biomarkers in relation to the timing of puberty, and they did find relationships between specific, chemicals and earlier menarche. I will not try to pronounce those words, but it was interesting to read. There are definitely some associations that they found. So reproduction, I know this is somewhat of a controversial topic nowadays, but certainly AI can be helpful in in reproduction. So it can help predict like fertility of women. It can help identify the quality of blastocytes or oocytes. It can also be used to help decision making algorithms for ovarian stimulation. Has the potential to be used in IVF to improve embryo selection, improve optimal IVF stimulation periods. It can also have the potential to provide access to information for patients. So, like those chat GPTs, they can provide information for patients about sexual and reproductive services. That maybe these are questions they'll ask the computer, but won't ask their provider. And so in that way, AI can help disseminate appropriate information to patients. AI also has the potential to be used in male fertility, so analyzing the characteristics of sperm, things along those lines. This picture I thought was really cool because it just shows all the different parts that go into assisted reproductive technology, and everything that is circled is an area that AI could potentially help in. So there's lots of opportunities to help in this field. And then there's a new up and coming thing called preemptive medicine, which is something we've all been doing. It's preventative medicine, but they've put a new fancy spin on it. Basically, this area is using AI to anticipate onset and progression of various diseases, and it can use genetics, biomarkers, biological data, et cetera, to make these predictions. Um, the goal is to provide therapeutic interventions earlier and help prevent progression. And hopefully can these, interventions can be done even before patients have symptoms. Hypertension is the area that kept being brought up as an area that a lot of studies have been performed in, because a large amount of the population has hypertension. So, our goal is to prevent the onset of pathology by predicting the elevation of blood pressure in individuals with normal blood pressure or at early stages of hypertension, uh, which I thought was interesting. All right. So now that we've kind of reviewed what's out there, what are the challenges and opportunities of implementing artificial intelligence in medicine? So there are a lot of barriers and limitations to AI in healthcare. The first being the lack of infrastructure standardization. So graphical processing units are a critical tool for efficiently training and running AI models. The cost and availability of this graphical processing unit hardware is a significant obstacle. So they're very expensive, not easily scalable, take up a lot of space, may not be readily accessible. So definitely a big barrier. There's also a significant skills gap within various technical disciplines that are critical to AI implementation. So this isn't necessarily just specific to healthcare, but even in other areas, there's just not enough people who understand AI yet. Um, the US Bureau of Labor Statistics is projecting a 36% growth in data scientist employment from 2021 to 2031. So, and that refers to data scientists that are specifically working with AI. So they see this as a big area of growth in regards to that. And then, like I mentioned, cost. So it's a high upfront cost to get the AI structures up and running. There are different systems and formats that make it difficult to integrate data. So we all have experienced this with the various EMRs. So some of them like to, play well with others, and others do not, and that can make it really difficult for patient care because of the way data is transferred to other systems. Sometimes it's unreadable, even if it's just a fax that's scanned into the computer. That makes it hard for humans, but also very much makes it hard for the AI computer systems to learn. If there's not normalization of the data, then the accuracy and reliability of these models can be compromised, which then leads to suboptimal performance and prediction errors. AI systems also must meet stringent validation and verification criteria before widespread adoption can occur. And so that's something we'll talk about a little bit more here in a few slides, but that is also a significant barrier. Like, how do we validate and verify these systems? Another barrier is that healthcare data is often incomplete, inconsistent, and inaccurate. So, this introduces biases and errors, which can affect the AI model trained on this data that is inaccurate and biased, which can then lead to flawed predictions and diagnoses. So, it could potentially perpetuate healthcare disparities and affect patient outcomes, which could then compromise patient outcomes and safety. So that is a significant concern in many parties, is that these systems are just going to perpetuate the disparities that we already see in our healthcare system. There's a black box warning on AI systems because sometimes it is difficult to understand how they get to their decisions. And so that can be very difficult in this field where, it doesn't matter that we got to A to B. We also need to know how we got there. The path is important a lot of times. And these computers cannot necessarily explain how they got from A to B. And that can make it very difficult for us to replicate that data, like confirm it. It can be difficult to explain it to our patients, like, how'd you get that? How'd you get there? Like, I don't understand. So that is a significant limitation to AI. Yes.
It seems like lots of information.
So it it can, to some extent. It gets to a point um when you, like, if you use one of these systems, it gets to a point where it doesn't make sense anymore and you have to, like, reset it. Um, it's kind of hard to explain. I can think of a time when my husband and I were using it. He was showing me how this happens, because it's like it gets it can't have a full conversation like a human, so it can't take into account all the things, and it gets overloaded. Um, it it can explain it to a certain extent, but then there's just some things it cannot explain. I don't know how to explain it either, honestly, because, and that's one of the, that is, one of the things. It's like we don't know how to explain it. Right. Yeah. And sometimes it can, but then sometimes it can't. Yeah. Another big concern is data privacy and patient confidentiality. So, we're training these AI algorithms on patient data. And so, are we making sure that patients, their privacy is being respected? It is a machine. It has the potential to be hacked. It has the potential for this data to be leaked. So, how do we ensure that does not happen? One of the other big limitations is that AI systems are not human. They cannot draw upon reason, they cannot draw upon experiences, intuition, gut instincts. They cannot connect to patients with emotions. They can't have empathy. They cannot participate in shared decision making. And so I think that is a really big limitation, and where us as physicians will always have a big place in healthcare, is that we can provide that. Patients want to participate in their care. They want to say, they don't want a machine just to say, this is what you have, do XYZ. They want options. And so the AI systems cannot provide that for them. And there is this continued need for the patient provider relationship. There is something to be said about the human touch, the human interaction. And these algorithms, they're literal. They're designed to you put in a goal, you give it a goal, it learns how to achieve that goal, and that's it. So AI can be very beneficial in medicine. I think some of these things we've kind of talked about already. So, while it does cost a lot up front, it has the potential in the long run to help reduce costs by helping with the creation of new drugs, finding new drug combinations, cutting down on time needed for that investigation part. Um, it can help reduce time to sift through data, um, things like that. It has the potential to be used in medical education. So it can be used for virtual patients for teaching. There's also a talk that there may be a shift from focusing on knowledge recall to focusing on using technology to find the answers you need. Um, there's also AI driven approaches that can facilitate the development of precision medicine strategies. So, helping us provide individualized patient care. So there are specifically AI-powered healthcare chatbots that are designed to specifically answer healthcare questions. Watson X Assistant is one that is purchasable. Again, had to provide information that I didn't want to get extra emails for, so I don't know how much it costs. Don't know that it would have even told me there. But it can be used. It is available. And these chatbots have the potential, just like they do for, excuse me, for like, the IT industry, like to help with simple tasks such as scheduling appointments, things like that, directions, um, and potentially help answer simple questions and then, say, you know, you need to call your provider, at this point, type of thing. So potential to help with, mommy calls and things like that. So I think one of the biggest things that AI can bring to healthcare is more jobs, new jobs. So we need people who understand the artificial intelligence, who can help manage it, create it, and help us as healthcare providers use it to be more efficient. And so health informatics specialists, in particular, are the people who create the algorithms. So they take the tools and methods and combine it with the healthcare data. Then we have our machine learning engineers that help manage the machine part of the algorithms, the data scientists that take the AI data that it gives us and figures out how we use that data, and then the AI engineers that kind of do a little bit of everything. So lots of potential for new jobs. We need to understand AI for several reasons. We need to understand it so that we can adapt to the changing job field. So, just like when we were transitioning from paper charts to EMR, it was a huge change. It took a lot of time and a lot of understanding, but it is important for us to be able to adapt so that we can provide the best care for our patients. We also need to understand it so that we don't just blindly accept it either. So we want to know that AI can have errors, can have biases, and be able to discern those. It's also important for us to be able to identify the opportunities for innovation and improvement that AI can provide, and use AI to help advance technology and society. And then it's also very important for us to understand AI so we can identify any potential security and privacy risks. So there are a lot of ethical concerns in regards to the use of AI in healthcare, um, mainly surrounding privacy issues um, and biases that exist in healthcare and concerns about perpetuating those biases with these algorithms. One big concern is we don't have a regulatory group right now for artificial intelligence. Like, there's no one who's like, these are the guidelines. This is what you have to prove that this does before you send it to the FDA. And that's, in the USA and in Europe, there's not any clear pathway on how these are supposed to be regulated or approved. So, definitely a concern. Um, but there are plenty of organizations that are trying to use these, are trying to find ethical and equitable solutions, focusing on patient safety and improved outcomes for everyone. So, in order to do this, we have to make sure that these algorithms are trained on a vast amount of data, and have very stringent validation process um, to remove bias before it reaches the algorithm. Um, see. So it's also important for us to provide patient consent and awareness regarding the use of their data for AI models. So, patients want to know that their data is being used to benefit others and themselves, but also want to know that it's being protected and respected. So we have to make sure that these algorithms are doing that. Accept AI is a guideline that has been created for pediatric data specifically. So its goal is to address potential bias in algorithms that may occur when using pediatric data. So it defines age-specific measures to prevent this from occurring. It's been designed to help guide researchers, clinicians, regulators, and policymakers. So it's designed to have safe inclusion of pediatric data in AI and machine learning research. So given the physiological, anatomical, and developmentally different um, the differences we see across pediatric age ranges and between pediatrics and adults, if we don't train the technology on these differences, then we are going to create algorithms that are not valid or usable in various age groups. So we have to make sure that children in all populations and in all age groups are represented when these algorithms are created. All right. So, in conclusion, at this point, there is little doubt that AI is going to become a very important part of our healthcare system, and that it is going to shape modern medicine. But AI should be used as a complementary tool. It is not a replacement for a physician. It is to help us. It could potentially reduce physician burnout, time to diagnosis, and subsequent treatment, potentially reduce healthcare costs in the long run, while increasing access and quality of care. But of course, as with everything, further research is definitely needed to make sure that these models are both accurate and applicable to all populations. And these are my future scientists. All right, any questions? Yes.
Are you low? Are you going to read the chat box, or are you just receive questions
Sorry,
verbally?
Dr. Folsom was asking a question here. Sorry, I know it's hard for people virtually to hear. So she was asking if anything that I have learned has changed my approach to AI moving forward. I would say yes. I feel like I am significantly more open to artificial intelligence than I was before. I was definitely very hesitant, like when we had that opportunity to get that AI device like program to help us with our note writing. I was very skeptical. Um, and, I definitely want more data, but I do see how it could potentially be very beneficial, especially in regards to sifting through information and collecting data and things along those lines. So I do think it has opened my eyes more. Let me see. So I need to show taskbar and go here. Okay. I don't see. Are there questions in the chat box? I'm sorry. I'm trying to find it. Oh, here it is. Okay. Is there any AI tool for detecting brain metastasis or bone metastasis? I am not sure about that. I didn't see anything particular, but I also didn't look for that. So there is a ton of AI algorithms in radiology. So I would not be surprised if there are algorithms for that. Does AI require a lot more people who can program algorithms? So it would not reduce human resources, but increase requirement for larger human resources. So potentially upfront, it could increase the requirement for more people. But I think in the long run, once the algorithm is created, um, and I don't believe it takes, once it's trained, you just need someone to be there to fix it if it breaks, just like a computer. So I think in the long run, it would not necessarily provide human resources in that regards. But there will definitely need people who can, fix the things when they break, help us interpret it. Because I will say, trying to understand these algorithms, like all the papers talk about the algorithm in detail that they use, and it is extremely complex. So we definitely need people who can explain that as well. So um, any AI tool to differential diagnosis of dementia, particularly Alzheimer's disease. I'm not sure. I didn't really look into this, but I again would not be surprised if there are people looking into this. Is there any known DLAI artificial pancreas system that is really accurate or working? No, I don't think so. Not yet. If so, how's the delayed effects are handled? So I don't think there is one that is working yet. I think the closest thing we have is the closed loop systems, but that that is a good question. The question, if there's a bad outcome, who do we sue? And so I think that um, that is something I saw about in the ethical discussion. So there's actually like a whole journal, just talking about ethical considerations in AI. And I think, it would still be the physician at the end of the day. Like, it is still the physician's responsibility to confirm what the AI technology or algorithm tells us. So it still falls to the physician at the end of the day, which is another reason that it's very important for us to understand it. Bec- oh, interesting. Oh, yeah. So yeah, that's a good point. I guess if they found like an error in the algorithm, certainly could be a yeah. Yes. Yeah. It's like the Omnipod 5. Yeah. Probably. I'm sure for if you use this technology in the office. Yeah. Absolutely. Absolutely. And I have done that. I mean, yeah, so I mean like these chat GPT, like you put in my patient has these labs, what do you think it has? And like I had a patient with SIADH. I put in the labs. It said this patient most likely has SIADH and gave me the reasons why. So it certainly has the potential um to help us like confirm or deny. Yeah, correct. Yeah.
If question about some research, it'll give me information.
Yes.
And then if I try and ask the question a different way, I get the same information.
Oh, okay. Yeah.
You know, so it's not like you can have a conversation or something.
Right, right. It's not there yet.
The way it is now,
Yeah.
but it seems like for a difficult diagnosis, because often if you got a difficult diagnosis, you might go out on the web anyhow. and put
Absolutely. And
what comes up.
yes, absolutely. Yeah, it's a good point. All right. Any other questions? All right. Thank you all for listening.